At this point, I say I wanted to do a
Hi, I'm
short
doing just a
video,
little
but it
short
turned out to
vlog
be a
today because I
really
wanted to talk
long
about
video. I'm sorry.
a procedure I had on my back, and I've had this before, twice before. And this section I think has been twice before, and one other section once before. I may be wrong about that. It's such a process you go through, and I'll explain that in a minute. What I had was a radio frequency ablation on the left side of my back, and what that is the nerves are kind of fried. And the thing is they grow back between 6 and 12 months, so you have to get it done again at least once a year. And I have 2 or 3 sections we do. I literally can't remember. And the reason I can't remember the process is one, I get laughing gas plus fentanyl plus I think Versed, and you don't remember it. I do know. Well, I remember bits and pieces. Like I feel it a little because my leg will kick a little bit when they hit certain nerves, which is very embarrassing because I've had the guys had to come and hold my leg down before. But the process is this: you go before they can do the nerve fry. You have to go through a process of having epidural injections, which are painful. You have to have epidural injections. I feel like I got something in my tooth. I'm sorry. Anyway, one on each side of your back because the nerves crisscross across your back. So you can't, if you have back pain in your left, you can't just do your left side. You have to do both sides because there are nerves on the right side that affect like your left side. The body's a wonderland, and so you have to go through 2 rounds. You have to go one day you go and get an injection, and then you have to kind of self-evaluate. Does it help? Does it relieve the pain? Because they're numbing it is what they're doing. And then like a couple weeks later, 3 weeks later, whatever, you go back and they do the other side, and then you go see the doctor. And then you, if it helped, they set your appointment for ablations. I'm not sure I'm even pronouncing that right. I call it a nerve zapping and a nerve fry. And then they do the fry in 2 sections. They do the left side, and then you come back a couple weeks later and you do the right side. And the shots are supposed to take about. Oh, hello! I do that every time, don't I? I end up doing something to the freaking camera. But anyway, I got over exuberant with my lip oil. See, this was just impromptu. I never plan my freaking videos. I'm sorry. I am not a content maker. I am a vlogger, and not even an interesting vlogger. My vlogs would be very oriented to specific people. Anyway, too close. Anyway, the the radio frequency thing helps. It's the first time I've ever had any period of time with real relief in my back. I've had back pain and damage to my back since I was a child. I fell down some stairs onto a concrete porch and hurt my back, and then as a teenager I fell downstairs again twice. A whole flight of them. Same stairs. Someone thought it was smart to put carpet on stairs. I don't know why. But at least not this carpet anyway. It was very slippery. And I was barefoot. Anyway. But, and those things really jacked my back up. And then anywhere I had injuries, I got injuries in my life, ended up, I've got my donut around my neck. I'm sorry, I just realized that. I'm such a dork. Anyway, those injuries, everywhere I had, and don't pet on, don't, baby, stop. The cat loves you, by the way. She really loves you. Tell the people you love them, baby. Hey, let's go over here. Hello, here's Gwenny. She's purring and she's got a wet face. Anyway, anywhere I got a lot of injury as a child, which I was very rough and tumble. I was like half tomboy, half girly girl, and like my knees stayed just bloody, scabbed over, skinned until I was at least 12. Hurt my back. I fell a lot and I got a lot of injuries. Everywhere there were injuries, I ended up with osteoarthritis starting as a teenager. And it was aggravated by being overweight, I'm not going to lie. But it also was because of having so many injuries, because I was falling on asphalt and concrete and stuff like that. And that was just not good because I fell hard when I fell. And no, you want to be over here. I'm not going to let you go until I'm sure you're done with the loving. Anyway, but don't you want to be in a vlog? No? Her meow's gotten squeaky. She kind of lost her voice a little bit. She's going to be 16 next month. 16. You an old lady? You an old lady? Yeah, she's an old lady. She's in good health, though. Anyway, I started developing osteoarthritis at 13, and in my knee, which is where I had a serious injury when I was 5. I literally busted my knee open like a watermelon, basically, on concrete. And I'm trying to get this up higher for a better angle so you're not up my nose and I don't have 100 million chins. Because when you do this... Please, baby. No, come here. Come here. Be a parrot. Anyway, so yeah, I had a lot of problems with my back, and I will always have a lot of problems with my back. I have degenerative disc, osteoarthritis, and a bulging disc or a slip disc, and my lower back, my lumbar is just horrible, and I have sciatica, and it's just a mess back there, and it makes everything more difficult. Standing, walking, sitting, laying, everything. Doing stuff, bending. Oh my gosh, bending is horrible. It interferes with exercise. I was doing aqua aerobics that I had to stop because when I got out of the pool, my back would be in so much pain, I would have trouble walking. And that was my source of exercise, helping me lose weight. It wasn't high impact because when you have osteoarthritis and fibromyalgia, there is no doing high impact exercise of any kind. You end up injuring yourself. And I've got so much damage in my back that fender bender accidents, they require me to go to the ER and get x-rays. Last April, a year ago, I was in a little fender bender. It was barely a little bump. And the policeman that came noticed I was in a great deal of pain and called an ambulance, whether I wanted one or not, basically. And they really insisted I go. And all it did was just jar everything. I didn't actually hurt myself, but you can, when you have damage in your back like that, you have arthritis in your spine like that, a little jolt can actually do some major damage. So, makes life a little inconvenient sometimes. But this is the third round, I'm pretty sure, of me having these, because I've been seeing that doctor for a little over 2 years. And he started in with the procedures pretty fast, and that was good, because he's the first doctor I saw who didn't just want to throw pain pills at me. I mean, he gives me pain medication to help curb the pain, because the pain is bad. My pain is never below a 6 on a 1 to 10 scale, and just to give you an idea of what that means for me, because some people exaggerate or they just have low tolerances. A 10 for me is literally when you wake up while they're wheeling you out of the OR after a major surgery. And I've been there and done that many times. I am covered in surgical scars. And I wouldn't even count doing coming out of surgery and all 10 of my and all of I've had 10 or 11 surgeries. I lose count now. I don't even consider all of those a 10. Like my gastric bypass was a 10. My knee replacements weren't 10s. They were only about an 8. Like you get the option of getting a morphine shot if the pain's really bad on top of taking hydrocodone when you have your knees replaced. At least my doctor. I took a morphine shot one time with the first knee, and the first knee, the muscles in my leg were very kind of not deformed, but kind of out of place and kind of, you know what I'm saying? My kneecap had slid to the side. I'd been walking for 10 years with no cartilage in my knee, and it was bone on bone. And it's sort of like my kneecap slid and it kind of pulled everything. So they put everything back all at once. And it was at least 2 years before I had this one muscle in my calf that stopped hurting. Yeah. So, but that wasn't even a 10. And it was just that first day that I had the morphine shot, just one time. And you're in the hospital 3 days and you're doing physical therapy twice a day. And so, but no, like my gastric bypass, the first day was a 10. Yeah, coming out in the first day was a 10, 9. But my pain kind of steadily stays 5, 6. On the medication I'm on. If I don't have the medication, it goes up to 7, 8. And but I'm never below 5, ever. On my best day, I am lucky if I am as low as a 5, and it's almost all my back and down my left leg because the pain from my back affects my left leg. Don't have a lot of upper body pain. There's a little shoulder pain in the winter. I'm probably got a little arthritis in that shoulder, not the other one. There's some hip pain. I do have bursitis because I'm 90 years old, apparently. And, but I don't have like lymphedema or anything like that. My mom had lymphedema, and a lot of overweight people who aren't active end up with lymphedema. And I mean, I say I'm not active. What that means is I'm not out going. I'm not working a job. I'm not taking long walks and exercising, but I am up and walking around the house, taking care of myself, taking care of the cat, taking care of the fish, taking care of the home as much as I can. It's not the greatest, cleanest home, but it's not horrible either. It's just like it needs to be dusted, and maybe I'm behind on the sweeping. Sometimes there's a few dishes in the sink, that kind of thing. Trash may be needed to go out a couple of days ago, It's just more of slow and not as clean as it should be, but not so unclean that I get in trouble when they do the apartment inspections. So I pass my inspections, and they have some pretty specific rules here. But so yeah, I had that today. Came home, had my crown come out on my tooth, and I'm supposed to literally go home and sit on my butt for 24 hours. So what am I doing? I've been running around and going and getting my tooth fixed. That was fun. I had a filling yesterday, which was very uncomfortable and downright painful because I have really tight teeth. And my dentist retired and sold his practice to a young dentist, and I had met him twice because he was there for a year before the guy retired. And I'd had the same dentist for a long time. And the young guy, unlike the dentist I'd had, was not aware of how tight my teeth are. And he had to put these wedgie things between my teeth to do to do the filling, and he almost couldn't get it out. He had trouble getting it in, and then like literally his hand slipped like 3 times, on our lip. I was just like, violence, He'll get the hang of it. I've got to break him in, you know what I mean? And he's a millennial. I have a millennial sticking his hands in my teeth. My old dentist was 54, so it's just strange. But there's a youngin' sticking his hands in my mouth. Martha! But, yeah. If you have problems with your back, you ever have an opportunity, a doctor offers to do a radiofrequency ablation, don't be afraid of it. The injections take 24 to 48 hours to recover from. Now, on the left side, it gets really angry, and it takes me longer than that to really get back to normal. But I also have fibromyalgia, which kind of amplifies pain. It's kind of like the ultimate drama queen of, oh, that's a pain. We're in pain. Now I'm like, dude, we're not in that much pain. Yes, we are. We're going to die. That's fibromyalgia. And that's one reason why, with my arthritis and my spinal damage, that my pain is so high on a daily basis is because the fibromyalgia is amplifying everything. It's like sticking a speaker into your a Beats pill or something with your iPhone. But yeah. And that's also one reason why it's hard to get my pain controlled. And I've been doing pain management for 11 years. So I've built up tolerances to medications. And what it takes to make my pain therapeutically low enough is way too much medication. And they can't do that. And I can't do that. I mean, I had a doctor who did that. He almost killed me with a accidental drug overdose and kidney failure. And I'm lucky I don't have to do dialysis now. And they said I was going to have to, but thank you, Lord above. I literally went from almost dead and hallucinating in a hospital to fine in 3 days. And I have been fine. It's been 3 years as of about right now. It's been 3 years, and my kidneys have been fine ever since, and it was a miracle. And that doctor got fired from being my doctor, and I tell anyone who will listen to me his name and to stay away from him. I had my second pain management doctor after him didn't care. He just didn't care. Nobody in that clinic cared. In fact, my doctor used to work in that clinic and left that clinic because of the way they were with people, with patients. And so my doctor I have now, I've been with him for 2 years. He's a good doctor. I've been with him since early 2015. He's a good doctor, and he's proactive with helping me with my pain, and that's good. It's very hard to live with a chronic pain condition because so many people become addicted and to the point of buying drugs illegally. And also, there are people who are fake having a chronic pain condition because it's most of the time there's not a lot of evidence you can get medically. With me, I do have MRIs and x-rays that show the damage in my back. I do have those records. But there's no way to prove fibromyalgia. He at once a year he does the pressure point or sensitive point test, and we talk about my symptoms. And right now, that's the only way to verify fibromyalgia is to push on certain parts of the body, and if they're extremely tender, which mine, you push on these points on my body, and I literally try to fall down. It's so bad. The pain is so bad. And I have all the symptoms, and, I have all these related conditions. Literally, fibromyalgia just kind of comes with this huge package of crap. So, but no, they test you for everything else that has similar symptoms. And if that comes back negative and the pressure point thing and they evaluate your symptoms, then they say you have fibromyalgia. There's no test for it. There's no real treatment for it. You see the commercials for Lyrica. Okay, if you have just developed fibromyalgia, I imagine Lyrica is very helpful. I've had it for 25 years, and for the first 15 25, 26 years. For the first 15, didn't get any help. And just declined, and my health declined because I wasn't active, because my activity levels, because I was active prior to getting sick. I was very active. I was as active, if not more active, than anybody my age. And at 21, I developed pneumonia because I was on a weight loss program that had me malnourished. It is not a program I would ever recommend to anybody because I got very, very sick and I was very malnourished. And when I got the little bug that was going around my group of friends, they all recovered from it after a couple of days. I was sick for like over a month, maybe longer. I mean, literally, time just vanished during that time. I was so sick. And I finally saw a doctor because I thought I was literally dying. And, I felt that horrible. And I had pneumonia. I developed pneumonia. And I was also malnourished and dehydrated. And he told me to stop the diet because I told him I was on this program. He's like, no, you need to stop that. Because they had me on they started me on 500 calories a day. And I think I was at 750 after being on that program for several months. And I lost water weight every month when I had my period. And they would accuse me of cheating because my weight would suddenly go up. Now, I would go in twice a week to weigh in and for my checkup. I would go in on Tuesday, okay? Have gained 20 pounds since the last Thursday or Friday, whatever. Sometimes I went in on Fridays, but I usually went in on Tuesday and Thursday. Sometimes Wednesday. It just depended. But anyway, my schedule was trying to be Tuesday, Thursday. And I would go in, gain 20 pounds between Thursday or Friday and Tuesday. And they would say I was cheating. There's no way I wasn't cheating. Come in Thursday, having started my period on Tuesday or Wednesday after that, and be 20 or more pounds less than I was 2 days prior. And I'd tell them I got my period. And it was just I would get extremely bloated before my period, and as soon as I started it, all the fluid flushed away. And I know that's really kind of graphic for some people and very TMI, but that's just how it was. I got extremely waterlogged prior to my period. I had really severe PMS. It was probably because of my mood swings and the severe cravings and just the way things were with me. It's probably premenstrual. It's PMDD, I think it is. It's more severe PMS, but I did have some massive PMS. And physical symptoms and emotional symptoms, no, you just didn't want to be around me. No. No. Anyway, but I was on that program, almost got pneumonia, and I never physically recovered. I never came back to my old self after the pneumonia. I was in a lot of pain all the time, all over. Very fatigued, no energy, and like a handful of other symptoms that were just weird. And it was like I got sick and never got better. And see, I've heard other people describe it this way, and it's so true. If you want someone to who doesn't have fibromyalgia to understand fibromyalgia, tell them, imagine having the worst flu you've ever had, but it never stops. You never get better. And it's very much like that, because your body aches and it hurts and you feel tired, and just you have problems with sleeping. You have problems with your stomach. You have there's a world of problems. And they also have found a relationship between fibromyalgia and osteoarthritis, fibromyalgia and depression and anxiety, which I have and have had pretty much my entire life. Anxiety started when I was a toddler. The depression started when I was probably 11, between 11 and 13, somewhere in there. I became a woman and I became depressed. But I never got, I was 21 years old and I never got better. And I just declined, steadily declined, lost more and more physical ability, was in more and more pain. And then you throw my back and my arthritis in there with that, and it just, I can remember times that I was out like shopping in a relatively smaller store or grocery shopping, and be at the checkout in so much pain that I would be pouring cold sweat and physically shaking and unable to form good sentences, unable to even write a check, because for the life of me I could not bring forth the knowledge I needed to write a freaking check. For those of you who are young watching that, a check is a piece of paper that you used to be able to fill out that took money out of your checking account. Now y'all just have debit cards. Or some of you pay with your phone with your debit card. Anyway, checks are something that, and since you can pay for everything online now for your bills, checks have just gone the way of the dinosaur. But, and there were times when I couldn't tell you my name or my address or my phone number when I was in that state, having pushed myself too hard. And, but I fought it the whole time. I didn't give in to it as much, you know what I'm saying? Until I had to. I would push myself too far. I'd push myself to the point of I couldn't form sentences, couldn't form thoughts because the pain was so severe. And I just went downhill, got less and less able to do stuff, got fatter and fatter, and didn't get to see a lot of medical people. And the ones I did blamed it all on my weight. Told me to lose weight and I'd feel better. That's all that was wrong with me. I lost weight and they found all this stuff wrong with me. And all the diagnosis came like within like a few months. Like between January and April of 2006, just bam, 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 bam. Some of it was corrected with surgery eventually. I had things taken out of me. I had things rearranged. I had things, some of it with medication, which every freaking medication in the world may cause weight gain. You know what? There's no may to that. It did cause weight gain because as soon as I got on these medications, my weight loss stopped. Just stopped. It had been a steadily decline in my weight. I was steadily going down after my gastric bypass, which I had so that I wouldn't feel crappy anymore because all my problems were because I was fat. So now I have all kinds of really severe stomach problems, which I get to go get a camera down my throat on the 24th. By the way, we're trying to figure out if I have ulcers along my staple line of my gastric bypass. There's something, we do know my esophagus is out of order, meaning that instead of going, the muscles, contracting and going in and out in order like this, one of them will do it out of order. And that may very well be why I throw up sometimes. Because sometimes I feel like my food is just hanging right in here, right in my chest. And that is not my stomach. And it will come up. I do get blockages sometimes in the hole that they put in my stomach when I had gastric bypass. And that is hell. That is hell. That's hell. Extremely painful. And it can take hours and hours and hours to get it up. You have to work on it. Anyway, I'm being gross. But I should have like awesome upper abdominal muscles from trying to work out those blockages, as well as all the vomiting I do. Think about it. When you throw up, there's those muscles in that one area that contract. Underneath my love handles, I guarantee there's like a 2-pack. Maybe a 2.5-pack. Anyway. But no, they're putting a camera down my throat to get a look. I've already done an MRI and a ultrasound, which they called me and told me, you do have fatty liver. I'm like, duh. I had fatty liver before I had my gastric bypass. It was testing, my liver was testing at levels of my blood work for the same levels of dysfunction as someone who has hepatitis. And within like 6 months of having my gastric bypass after losing weight, it was still a fatty liver. But it was at healthy levels, and it stayed at healthy levels since 2005. So I'm not, look, calling me and telling me I have fatty liver and that I should follow a low fat XYZ diet, which I'm already on because of my gastric bypass. I follow my diet pretty well. I'm actually legitimately counting my calories and fat and sodium and protein and carbs and all this stuff on a daily basis, unless I decide to have a cheat day. And all that is I don't count my calories, and maybe I have a little more carbs. And okay. I've taken to having like a lollipop every day because I used to be a really bad sugar junkie and chocolate junkie. And in the past year and a half, I got put off on it really badly. I barely can stand chocolate anymore. Barely stand caramel. Loved caramel. But like lollipops, I like to have a lollipop a day. If not a lollipop, a little 6-pack of now and laters, cherry now and laters, just the cherry. Or like 4 to 8 Starburst. Try to do 4. Sometimes I do 8. I admit that sometimes I do 8 Starburst. But that's kind of, like I had some Starburst jelly beans that I was eating like 6 or 7 at a time, and I didn't even eat the green, yellow, or purple. Threw those away. I was eating red, orange, pink, like I do with Starburst. I don't eat yellow Starburst, first of all. I don't eat yellow. I like the all red colored ones. I like those, and they're evil. They've come out with the ones where it's bags and packages of all pink. That's evil because I love those. That's my favorite flavor. I would not be able to control myself with a bag of strawberry Starburst. But I do like cherry and orange a lot, and I like some of their other flavors like watermelon and fruit punch. And the ones that is the flavor eds are like strawberry, cherry, watermelon, fruit punch. That's like my favorite. I'll get a little single thing of it and eat like 4. And but I've been doing that, having that once a day, and counting those calories. I count those in my calories. I'm trying to do like 1,600 calories a day. The fat, I forget. The fat is actually I'm using a website to help me to keep things balanced the way they need to be. And the fat is actually higher than I would normally go. But since I've reduced my carbs, it's kind of hard to get everything I need to get nutrition-wise, like all my protein and stuff, and keep the fat a lot lower than that. So, but it keeps everything at a healthy balance, and it helps me with my blood sugar, with my hypoglycemia, to not get too low and have episodes and end up passed out on the floor trying to get conscious enough to drink some juice. I literally will keep 1 or 2 individual juices. I'm not a juice drinker. It's a lot of sugars and a lot of calories for a beverage, and I'm not really big on drinking my calories. I feel like that's a waste. It's every once in a while I'll have like a soda. I'll have like a Jones cream soda or something like that because they use cane sugar. They don't use high fructose corn syrup. I try not to drink any soda that has high fructose corn syrup. Like after I had my teeth done yesterday, I had a really disgusting taste in my mouth, and I had to stop at the grocery store, and I found a glass bottle of Dr. Pepper, in like an old school glass bottle, that was no corn syrup in it. And I drank that because I like a Dr. Pepper every once in a while. And I like a Mountain Dew every once in a while. And they have those as well in glass bottles with no corn syrup. And so that's good. I can have that every once in a while. And they're not really big bottles. They're not really big servings. They're very small, actually, for compared to even the cans and the plastic bottles and stuff. So definitely fountain compared to fountain drinks. Anyway, but I just don't keep that stuff. I have to actually go get it. I don't keep that stuff in the house. Like there's a little convenience store a couple blocks from me that has the Jones cream soda. I like that every once in a while, and if I'm and I don't have a car, so it's not like I can go get it. So I have to call my aunt and say, "Can I get a ride? Can I go to the convenience store, or can I go over here where the Dr. Pepper is?" That kind of thing. Because this stuff is only sold in certain spots, so it's not like I can just hop, skip, and jump go get the thing. I have to literally plan it out, and it has to be a whole thing. But diet's not perfect. My diet will never be perfect. My diet was not perfect at any point except for in the first 8 weeks where it was liquid, and I barely could eat what I actually didn't completely eat what I was supposed to eat in those first 8 weeks, but I was on a liquid diet, and it was sugar free, and there was pretty much no carbs. I take it back. I was allowed to have extremely runny oatmeal with milk in it, I think. Very, very squishy, very, very soupy oatmeal. Because I had that in the hospital after the surgery. But it was pretty much a liquid diet for 8 weeks. And I lost a lot of weight, and it was easy to stick to because my stomach was very just kind of tender from the surgery. And it's not an easy, gastric bypass is not an easy surgery to have. And I do really well with surgery. I do really well with recovering. And it was hard. It was hard for me. I would say it was harder than both my knee replacements put together. But that's not saying that much because my right knee replacement was just, it was nothing. I was like, oh, I'm done. I'm walking. I'm ready. And they dismissed me from physical therapy after 2 sessions at home physical therapy. I was in the hospital. I had it for 3 days in the hospital. Had 2 days at home. And she was like, you don't need physical therapy. You are fine. I'm like, I know. I am super girl, Wonder Woman, Batgirl. I'm all the superheroes, female superheroes wrapped into one. No, really, I'm Wonder Woman. I just look like this. This is a disguise. I'm really Wonder Woman. I thought that being Diana Prince wasn't low key enough, so I have this great disguise of this middle-aged fat chick with purple hair. She's kind of artistic and creative and funky and weird. And yeah, that's my cover now. But don't tell anybody. Keep it on the down low. Okay? I'm really Wonder Woman. My invisible jet is parked outside in the parking lot. And people can't figure out what they keep bumping into out in that parking lot. And did you know the invisible jet has an invisible dog in it? Security. Water in a Starbucks cup. I do like to get, on occasion, a green tea with peppermint. It actually soothes my stomach. And it's cracked down here. And anyway, I dropped it. Anyway, but and they've started using cane sugar instead of their simple syrup, which was, simple syrup is just refined sugar and water cooked and reduced. And I'm really happy about that. And it tastes a little different. It's not as sweet. Nothing made with cane sugar is as sweet as with refined sugar. But that's okay. But no, something about green tea with peppermint makes my stomach feel better. And it also flushes out toxins. It's a diuretic is what it is. And so I have myself a Starbucks green tea with peppermint on occasion. And yes, there's like 200 Just over 200 calories in a Trenti or a venti. Yeah, there's just over 200 calories in a venti. And again, don't like to drink my calories, but it's kind of a splurge, but it also has health benefits as well. So I used to drink a lot of Frappuccinos without, I would do light without whip. I never get whipped cream on anything ever. If it has whipped cream on it, I tell you no whipped cream. I hate whipped cream. So nothing, no whipped cream, and I would do light. I couldn't do the completely non-fat because non-fat dairy is just the grossest thing in the universe to me. But I could do 2%. I'm good with 2%. So, and with the light, I would have them mix the sugar-free syrup and the regular syrup, do half and half, because sugar-free stuff. Actually, I can't do sugar-free syrup anymore. I take that back. It's been a long time since I had a coffee. My doctor, when I had kidney failure, told me to stay away from artificial sweeteners because they're very bad for your kidneys and your liver. So I cut out. If I wanted something sweet and chocolatey after gastric bypass, I was doing sugar-free pudding, and I can't do that now. Non-fat sugar-free pudding. Anyway, basically just chocolate powder ground up with a bunch of other chemicals. Anyway, yeah, I had to cut that out, and I had to cut sugar-free popsicles out, which I would have like one a day, and I do still do popsicles though. They're like 40 calories. I have a popsicle before bed every night. The sugar and the acid helps dissolve my Ambien before my muscle relaxers. If my muscle relaxers dissolve first before the Ambien kicks in, it becomes like a bad freaking drug trip, man. And it's almost those muscle relaxers, the ones that I take. It's almost like it opens up your third eye, and you're seeing little faint shadows moving. Everything becomes alive. It's just a little bit like I think acid would be. Like really light acid. Because let me tell you, Heather was seeing some things some nights that, and it's like my eyes felt like they were just very open, and like I could see things that were hiding in plain sight that I wasn't supposed to see. I swear, I almost feel like I could see fairies. Not really. That's a joke. That's a joke. That's a joke. That's a joke. I was if you've ever read the Harry Dresden books, I'm thinking like that, like seeing fairies and like Maeve and the Winter Queen and Summer Queen and whatever, all that stuff in that other world and that Dresden goes to and Dresden talks about opening his third eye and seeing things as they really are. And yeah, to Xanadine, because I can't just take one anymore because I've grown immune to it, and my doctor knows about this. What I have to take to sleep and to keep my body still because I have restless everything. It's all just twitches and cramps and from the fibromyalgia when my body tries to relax when I sleep. It goes crazy. Every little nerve is dancing and on fire. Every little muscle and tendon is popping and twitching and just it's bad. It's bad. But yeah. So and I have to take Ambien because fibromyalgia comes with severe insomnia, and without it, I literally don't sleep. And the more I don't sleep, the more manic I become, the more hyper I become. So, taking the muscle relaxers and the Ambien allows me to kind of reset every day and start over like my cable box. My cable, it has a DVR. It like 3 o'clock every morning. It restarts. It's kind of what Ambien and Xanadine are for me. I'm sorry, baby. I didn't know you were there. I accidentally bumped the cat. She got all belligerent and hissy about it. Have a hasty fit. Anyway, this has been 45 freaking minutes. I'm sorry. If you're still here, thank you. I'm trying to work on my times, and I've been getting better with some of the videos I've been posting about times, but I just wanted to vlog. Benny Meyer does videos this long, but he's much more interesting than I am. So, as always, feel free to ask me any questions in the comments below about any of my conditions. If you're rude, I'll ignore you. Either that, unless I'm in a bad mood, then I will take you to task. Someone's gonna get a whooping. Cut me a switch. Most southern thing I could ever say is someone's gonna get a whooping. Cut me a switch. There's hairspray in my hair. I had hairspray in my hair, and now I got roots, man. What color should I do my roots? Candy pink? You think? Just an inch of pink. I think I'm gonna let it grow out some and then do pink on my roots and keep the purple and the blue. Okay. And let's see, I've got so much freaking product in my hair. It's just like, oh. Anyway, I brushed it out. I had it braided all day and I brushed it out. It's ugly. Okay, gonna go. Ask me any questions. And my question for you is, what is a treat that you have on a daily basis that is not necessarily the best thing to have, but it's like your little treat? Or even if you don't have it daily, what is your little treat that you have? Like my lollipops or my now and laters. What is it? What is yours? Have a good night. Have a good day. Have a good morning. Have a good week. Have a good everything. May unicorns and rainbows dance in your dreams. Unless those things scare you, then no. Bye. Peace, babies. Peace, babies. Peace, babies.